Hello there, welcome to another OET lesson. This time we're focusing on the OET writing subtest. And we've all seen how in some case notes there seems to be a lot of information on them. Patients often come in with multiple visits to the practitioner. Sometimes a patient has had different visits to the GP because there have been changes made to medication. And sometimes there's been a progression of symptoms which is evidenced over various visits, maybe two or three. The question is, how can we summarise this information into neat paragraphs? How much information should we include? Should we detail every single visit and what happened in every single visit, every single change made? And these are questions that I'm sure are going through a lot of your minds. And actually, one of my YouTube students, Tharushi, got in touch and asked me for help with this. So I thought I'd offer you some guidance because I know this is a question key for success as well. My name's Sona, I'm your online OET tutor with Bose Learning and I'm a premium preparation provider of the OET. Thank you for joining me today. So then, what is the easiest way to decide what to include in your OET letter? So when you're sitting at home practicing and thinking about what to write, here are some things you can think about and then of course transfer these skills into test day. So, the easiest way to decide what to include is to put yourself in the shoes of the reader. Imagine that you're the consultant or specialist or healthcare practitioner who is going to receive this letter about the patient. What would you want to know? Do you have time to read about every single little change that's happened to this patient? Probably not, right? And it's probably not even relevant. So think about presenting the highlights to your reader, just the most significant changes and their results, and then think about details of what the reader has to do next, because that's what you'd want to know if that was you. You would want to know a nice little summary of what happens next. It's also worth bearing in mind the word count in the OET. Now, the guidelines say somewhere between 180 and 200 words, and there's a reason for this. It's because you should be able to summarise all the main points within these two figures. But don't stress if you end up writing 177, 178, or even 205, because they're not actually going to count the number of words. They just want to make sure that all the information that you have presented is relevant and is efficient to read. So this means that you are going to need to do some clever summarisation of events. Let's take a look at an example together. So you've got a patient called Sarah Johnson and we've got her date of birth here. And you can see that she's visited you with persistent joint pain and swelling in the knees and wrists for the past month. And she came to see you the first time on the 1st of March. There was no significant medical history reported, no known allergies, and the assessment, which is subjective, was a bilateral knee and wrist joint effusion, limited range of motion, tenderness, etc., and no inflammation elsewhere. The plan was to do a complete blood count and look for RF, to prescribe analgesic, and to advise rest and application of ice packs, which is pretty standard. Visit number 2, we can see the patients come back to you 3 months later and they have returned with persistent pain and increasing difficulty. The blood test results that you ordered indicate elevated RF levels. We have the amount here. You can see increased joint effusion and the patient's now reporting stiffness lasting more than an hour. So your plan of action is to refer this patient to a rheumatologist who you're going to write to. You're going to prescribe oral corticosteroids and you're going to refer the patient to physiotherapy. So how can you divide the information about these two visits into your letter? Should you write one paragraph about the first visit and then one about the second? Or should you divide it by presenting concerns and treatment? I would think of it this way. Will knowing about the initial visit help the reader? And yes, it will, because we'd get an indication of time to see how fast or slowly things are changing. Will knowing about your initial observations help? Yes, of course, because it shows us these changes that have happened. What about initial prescriptions? Well, probably not. I wouldn't have thought. I'm not medically trained, I'm an English tutor, but I probably think that, ibuprofen and ice packs are fairly standard, and the second prescription replaces the old one. So I think that's irrelevant. Will knowing about the second visit help? Yes, of course, because we've got this context of change going on. So, the main points then from asking ourselves these questions, we can see that the paragraph should center around change. In this case, the progression, the deterioration of her symptoms, of her condition over time. And we need to evidence this with our observations that we made, the test results, and the patient's own reports. So that's how I would structure my paragraph. And let me give you an example of how this can be done. So, of course, you write your introduction. I'm not including that here, but you can check out my other videos which talk about how to write an introduction. This would be your first body paragraph. And you introduce to the reader what the problem is. So we've got it here. And let's break this paragraph down. To save you guys from counting, it's 99 words long. So we start off this first body paragraph by introducing the patient's condition. We of course introduce the patient in our opening, don't forget to do that. But this is a deeper introduction of the condition. Mrs. Johnson has been experiencing persistent joint pain and swelling in her knees and wrists, and we give an indication of time for the past 3 months. We then mention the first visit in combination with the test results, so it's a really nice way to summarise both ideas. Blood tests taken after her first visit in March revealed elevated RF levels, and I give the evidence. And then I go on to describe the report given by the patient herself. And in an appointment with me today, Mrs. Johnson reported persistent joint pain and increasing difficulty in performing daily activities, together with morning stiffness lasting more than an hour. Finally, I talk about my own observations and again compare past to present. In comparison with my first examination, Miss Johnson today also displayed increased joint effusion in both knees and wrists. So you've got a nice combination of both visits in this one paragraph. And there's no need to detail each visit separately. It's more efficient and it makes more sense to combine ideas as we've done. You've then got about 90 words or so left. So you've got your opening to write, then you write this body paragraph, and then in the second body paragraph, you'd write about the referral plan. Finally, of course, you'll need a line or two to restate the purpose and end professionally. I've not included that here today because I just wanted to focus on this combination idea. So go away and check out my other videos if you want to find out more about that. But I do hope you found this useful. For more advice, check out my blog, which is on boselearning.co.uk. And if you like this video, it would be so lovely if you could share this with a friend or colleague, give it a like and say hello. And if you've got any questions like Tharusha did, please feel free to drop me a line and I'll try and get back to you with some solutions. Thanks very much for watching. Take care and hope to see you again soon. Bye.